Fist is the thumb with thumb inside the ulnar deviated. Okay, inside the ulnar deviated. Okay, pain along with the radial side. Okay, pain along with the it is a thumb fist பண்ணிட்டு ulnar deviate பண்ணும். Pain along with the radial side. Okay, in case of pain present radial side is confirmatory test for the finger decoding disease. Okay. Then look, hand is meant for Froment sign. Froment sign is the purpose of ulnar palsy. Okay, procedure: patient grips paper between the thumb index. Paper between the thumb index. Okay, so that is in this area. Okay, grip on this ID card. Okay, so in the index finger pinch and the thumb finger. The both of the in case normal muscle strength with the grip. In case any no lesion is not gripped by the patient. Okay, that's also in case weakness of the ulnar palsy. Mainly muscle group for the in the IP chart of thumb is the weakness. Okay. Then shoulder sulcus sign. This is also for shoulder instability test, mainly for inferior dislocation test. Okay. Purpose of the test is the inferior shoulder instability. Procedure: pull arm downward direction. Scapula stabilize, then downward direction. So visible sulcus below the acromion. In case the sulcus is present in the patient, you will confirm it for inferior shoulder dislocation. Then shoulder by speed test. Speed test mainly for bicep tendon pathology. Okay. Procedure: resist the shoulder flexion with elbow. Shoulder flexion with elbow extension. Pain at the biceptal groove. The positive for the biceptal tendinitis. Then functional screening test. Okay, that is include combined movement pattern to detect the multiple joint dysfunction. Okay, combined movement pattern to detect the multiple joint dysfunction. Okay, shoulder, elbow, wrist. Okay, the functional movement screening test is mainly the first feature is go for deep squat test. Squat is a full squat in the 10 second deep squat. How much squat is possible to the patient? You will check the patient. That is a deep squat test. Second one is an active straight leg raise test. Active straight leg raise. In patient on the supine lying position, will go to active limb raise on the full without knee bend. Okay, knee bend, full range, assess the active knee bend test. Okay, also symmetrically assess the patient. And third is the knee lunges. In case knee lunges, okay, patient one leg and the kneeling, other legs the kneeling position is a sit down position. Okay, then third is a rotating stability test. That is a quadruped exercise or quadruped Spiderman exercise. That is rotating stability test. Okay, then fifth one is a hurdle test. The hurdles sports, the hurdle running. So on the hurdle test is a jump to the leg. Okay, then trunk stability for push-ups. Test. Okay, then shoulder mobility test for in case of the one arm is the arm abduction, elbow flexion, then internal external rotation. One arm is the arm extension, adduction, then elbow flexion, then internal rotation. Both arm touch the shoulder, back of the joint. In case not touching, is the issue of the shoulder or tightness of the muscles. Okay, this is a functional screening test. Okay. Okay, summary of the class. The summary of this class was the upper limb special test will help identify the first one is the impingement syndrome. Shoulder of the impingement syndrome is the first identified condition. Then tendinopathy conditions. Then no compressions. Then instability. Instability means joint dislocation. Then functional deficient. These are all the conditions are found out in this special test. Okay. Okay, students will go for in-class assessment. The niche test is used to detect what is the condition. A is a supraspinal tear, B is the bicep tendinitis, impingement syndrome, then D is a shoulder disability. The correct answer is impingement syndrome. Second is a Hawking-Kennedy test which is muscle. Deltoid muscle, supraspinatus, subscapularis, and latissimus muscle. The correct answer is a supraspinatus muscle. Third, drop-arm test indicates the biceps tendinitis, rotator cuff tear, shoulder dislocation, or AC joint instability. Correct answer is rotator cuff tear. Then application test mainly for anti-application to check for posterior instability, inferior instability or anterior instability or impingement? The correct answer is the anterior instability. Then clinical reasoning question. Okay, in case a patient reports the pain on the resisted wrist extension, which test they confirm the diagnosis? Okay, it is a patient on the resisted wrist extension. The which test confirm the diagnosis? Okay, first one is a Mills test, Cozen test, Finkelstein's test, Fallon's test. Okay, the correct answer is the Cozen test. Okay, then if patient shows positive cervical sign under the apprehensive test, what is likely? Rotator cuff tear, multidirectional instability, acoustic capsulitis, and biceps rupture. The correct answer is a multidirectional instability. Then weak pinch grip with the positive prominent sign of mediano, ulnar, radial, muscular. The correct now is the ulnar palsy. Then pain on the thumb, abduction and ulnar deviation. It indicates carpal tunnel, decubitus tenosynovitis, duplicating contracture, disc pain. Correct answer is the decubitus tenosynovitis. This is for the gamified assessment of the class assessment ideas. Okay. Okay, student. This class is mainly reference for the textbook of orthopedics examination. David Maggie book is all orthopedic examination special test procedures. Mainly, you will go through this book for very important for this book. Okay. Then textbook of orthopedics John Abination is the management part is really useful for this John Abination book. Okay, very useful. Okay, student. Thank you.